Nutrient needs change as we grow older. To talk about nutrition and aging, let's start with physiologic changes that affect nutrition. As we age, fat stores increase and muscle mass decreases, which can affect energy expenditure, lowering the basal metabolic rate. The sense of thirst decreases, which increases the risk for dehydration. So it's important to remind older people to drink plenty of water and other fluids. Bone density decreases, which can limit mobility and limit the ability of the person to take care of themselves. GI functions change, which can increase the incidence of constipation, diarrhea, or other GI issues. Cognition may change, which can lead people to not remember to eat, or if they've eaten, or how to cook or shop for groceries. In adulthood, nutrients are used to maintain rather than support growth. So as you think about nutrients, the changes as we age, try to tie the nutrient needs to the physiologic changes that we just talked about. So for example, energy needs decrease with age. The basal metabolic rate decreases as body fat stores increase and muscle mass declines. Now, there are no changes in protein needs. However, intake often decreases because of issues with teeth, changes in taste, or GI issues. For example, those who've lost teeth may have a hard time eating some high-protein foods like meats. So you want to have them try softer protein foods, such as scrambled eggs, or beans, or tuna, or peanut butter. You want to encourage fiber intake, so foods such as whole grains, fruits, and veggies, because constipation becomes more common as the digestive tract function slows, and fiber helps to bulk up the stool and reduce the incidence of constipation. For vitamins, vitamin D synthesis declines fourfold as we age, so many older people may need a supplement, and because bone mass decreases with age, vitamin D is important. Vitamin B12 absorption can decline because of stomach acid declining as we age, and you need the stomach acid to release the B12 from protein in foods. Many elderly are deficient in vitamin B12 and may benefit from a supplement or fortified foods. Now, iron status improves as people age, so generally iron should not be supplemented. However, calcium absorption declines, and this, along with declining bone mass, suggests that adults need to consume foods high in calcium like milk, cheese, and yogurt, or possibly take a supplement. Overall, many elderly people would benefit from a vitamin mineral supplement designed for elderly that contains vitamin D, vitamin B12, and calcium. Dehydration is a major risk for adults. Total body water decreases with age, meaning dehydration can occur quickly, and the thirst mechanism declines, which means thirst lags behind dehydration. So it's good to remind older people to drink as they may forget. 80% of older adults don't meet the physical activity guidelines, and 34% are inactive. Muscle mass declines as people age, and activity helps to maintain the muscle mass, which can improve balance, mobility, and the ability to care for themselves. Older adults should aim for 150 minutes of moderate activity a week. If they have a chronic condition that does not allow for them to be very active, they should be as active as possible.